Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. A collaboration with Syracuse University's SI Newhouse School of Public Communications is helping students in Upstate Medical University's Norton College of Medicine learn how to help patients understand medical conditions. To learn about the Targeted Rural Health Education Program, I'm talking with Lauren Meyer from Upstate's Department of Family Medicine and Lauren Bavis from the Newhouse School. Welcome to the Informed Patient, both of you.
Thank you.
Thank you for having us.
Tell us about the Targeted Rural Health Education Program. How does it work?
Students in our Rural Medical Scholars Program, which is a part of the Norton College of Medicine, have the opportunity to participate with the TRE, T-R-H-E, course as part of their clinical education.
Is this a required course or is it an elective?
This is an elective course that students in their third and fourth years of their medical school that are within the Rural Medical Scholars Program can choose as like an add-on to one of their clinical experiences in a rural area.
Now, does the class meet virtually or are you in rural areas?
The students are out in rural areas all across the state of New York. So we, Lauren and I, meet with them asynchronously or virtually so that we don't have to worry about travel.
I see. Now, what would you say the program's overall goal is?
This particular course, the TRE course, the goal is to make our physicians, our future physicians, advocates for their community in the way that they are seeing, health concerns on a more global level amongst their patients and, taking their knowledge to a publication to give the population some tips and tricks of how to deal with these issues that they're seeing.
Do you have themed lectures? How does the class actually work? And I've been talking, just for listeners, I've been talking with Lauren Meyer from Upstate, and now I'm going to speak with Lauren Bavis from Syracuse University.
So the course starts with 2 video recorded lectures that can also work as podcast episodes for the students to listen to. And they actually mirror the introductory journalism course that I teach at Newhouse that really tries to help the students first understand what makes the topic that they might want to select to write an editorial about what we call newsworthy, or why would anyone actually want to read it. So the first thing that we actually talk about are the elements of newsworthiness, which isn't something I think most medical students have to think about. And we have a fun acronym for that, which is NITPIC, which stands for novelty, interest, timeliness, proximity, impact, and conflict. And so I go over sort of what actually would make someone want to read an editorial about a health concern in the community that you're seeing while you're practicing. Is it because it's something unusual or it has never been seen before in your community? Is it something a lot of people are talking about when you've been in the grocery store? Have you overheard conversations about people, wondering about this condition or hearing about a friend who had this problem? Is it particularly timely? Right now we wouldn't publish an editorial about going to the beach and having beach safety, right? But you might publish that in the summer. Is this something that's specifically happening in your community, or is it happening somewhere else and it might end up impacting your community? That's what proximity means, around your area. Is it impacting a lot of people, right? Or is it something that could have ripple effects? You have one health condition and it might impact your health in another way years down the line. And then conflict, there is so much misinformation in healthcare right now. So are there multiple sides of an issue? Is there something that these students can bring to the conversation that kind of sheds a light on the health issue in a new way that readers may or may not have considered before? So after the students learn about those elements of newsworthiness, and Lauren could speak to this more, then they perform a community health needs assessment where they essentially write a short paper that looks into what are the issues that are impacting their community. And that helps them kind of narrow down a specific focus for what they want to tackle in their editorial.
So it sounds like they have a wide range to choose from. They have to pick something that's relevant to where they are working.
That's correct. So we ask them to at least be a few weeks into a rural clinical experience and to have that experience before they come to us to want to have their, what we call their green light meeting, where we both sit down with them and discuss their maybe many topics and filter that down to the one that they're going to focus on.
These are students that have spent the first couple years or more of medical school learning medical terms and words that the general public doesn't understand. How difficult is it to then translate those medical terms into a language that can be understood by someone who doesn't have medical training?
This course has been a lot of fun for me because it is sort of reverse engineering the problem I had when I was working as a health journalist, was that I would be reporting on a subject and knew I had to translate a concept to a general audience and would be speaking to a doctor, a researcher, and they would give a great explanation of whatever the issue is. And then my favorite thing I would say to them is, thank you so much for that. Can you now please explain that to me like I'm 5 years old? Because we're really trying to break down what this means for someone who didn't go to medical school. I have the same problem with my students where they're used to academic writing. They're used to writing essays. They're used to writing papers that have a thesis, and then they're supporting their points by evidence, and then there's a conclusion. So this is, kind of across industries, a problem that folks can have when they're learning a new style of writing. After actually we talk about the elements of newsworthiness, the next lecture we go into talks about breaking down your writing and really kind of following these three principles of your writing being clear, concise, and conversational. And it's clear in the fact that it's not written in these really sort of long sentences and passive voice that don't quite get at what you really mean. It's concise. We give them a word count. I think they're writing between 500 and 800 words for these editorials, maybe a little bit less. And that can depend too on the standards of where they hope to publish the editorial. And then conversational, it should be how you talk to a friend. It should be how you talk to your parents, talk to your significant other, right? And that really helps them as they're learning how to talk to their patients in the exam room, because the way that they would talk to a friend in medical school about a case is not the same way that you can explain it to the person who's sitting on your exam table, who not only doesn't understand, but maybe is scared, maybe is unsure of what this means for them. So it's been a really interesting practice to get the students to move from this more academic writing into more layperson writing. And one of the first exercises that we do with them is giving them language from a research article and saying, rewrite this sentence in a way that I can understand. Take out that jargon, take out the complicated sentence structure, write this in active voice, maybe make it half the length, and make it so that me, someone who has not been to medical school, can understand what you're saying.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with two Laurens about the Targeted Rural Health Education Program, Lauren Meyer, who is the director of Upstate's Rural Medical Scholars Program, and Lauren Bavis, who is a former health reporter who is now on the faculty at the Newhouse School. Now, the op-ed or the informative public health article, can you tell us some of the topics that students have chosen and why?
I think our first published article was about rural stroke outcomes. That was one of our students who's actually interested in neurology, and so that made a lot of sense for her. Our second article was about asymptomatic hypertension and when potentially it's better to go to your primary care physician and when maybe patients should head to the emergency department. And then probably our most off the wall, if you want to say that, article was about chainsaw safety in the Glens Falls region. One of our students worked in the emergency department at Glens Falls Hospital, and unfortunately, this was something that he encountered during his time there. And in terms of the interesting factor that Lauren talked about, we thought this one was going to grab people's attention.
Well, let me shift gears a little bit. What advice do you have for doctors in talking with their patients about a new diagnosis?
Yeah, I think this goes back to what we were talking about like the plain language writing piece. I think it's very important that physicians have that ability to translate that medical jargon for their patients. I still think it's important to use it in some fashion though. Think about people opening their charts, their electronic medical records, and trying to sift through their after visit notes or their procedure summaries and seeing this jargon. If their physician has taken time to maybe define some of these things for them, when they're sitting one-on-one, I think it makes it more personal and you can see what's happening in that medical record. But having that ability to take that jargon and put it into a plain language for your patient, written is wonderful. And we're doing this kind of on a big scale to have an impact on a community. But our patient or our students tell us this helps them while they're sitting there with their patients in the exam room as well. And we've had that feedback from a number of our students who've done this course.
Is there any discussion or concern about not coming off as condescending?
There is. And we've worked with some of the students who've enjoyed writing their editorials for this class so much that they've wanted to continue writing. And we had a great conversation with a student who was writing a piece in part because they were frustrated with a conversation they had with a friend about a not very well understood medical condition. And it sort of seemed like they wanted to kind of shake some sense into their friend and didn't understand why they, were falling for misinformation that they were seeing on social media. And how is this happening? And that led to a great conversation about that is where your average patient might be finding out information, right? They might come to the doctor's office with a preconceived notion of, this is what I think is wrong with me, and I don't trust the clinician who could potentially help me. And so another thing that we've really worked to do in these editorials is bring the students' personalities into them, right? Like these shouldn't just be something that you could read on WebMD or type into Google and get any kind of health blog that tells you, here's the basics of the condition and what to look out for. Part of what we're trying to do is humanize doctors who are working in your communities and talk about the impact, what it means for them when they see this in their exam rooms. There was a great kind of what we in journalism call a scene, but it's a description in an editorial or an article about something that a doctor saw. And it was about this young doctor who saw a patient who I believe was in the midst of having a heart attack or who had just had a heart attack. They left the room and came back and the patient was drinking a soda. And they thought, wait a minute, like this is something that likely has been a habit of yours for years and is contributing to your, really dangerous medical condition. And that moment really humanized and made me think like, wow, how are my doctors thinking? I'm thinking about myself and my concerns on the exam table, but also bringing their personalities, their perspectives, and talking about why it matters to them to treat the patients in their community well and why their community's health matters to them and the work that they do.
I realize the program is for students who will become doctors, but do you have any advice for patients in terms of making sure they understand what their doctor says? Because it can be a little intimidating to be a patient.
Ask questions, right? That's what they're there for. And rather than just jotting things down maybe and going to some sort of AI bot or something, after your appointment and feeling confused, ask questions. Physicians are teachers, right? They want to do that for you, even though they're pressured and they have time constraints and things like that. Absolutely. But this is part of why they enjoy medicine. They all say they're in this to help people.
You said jot things down, so take notes actively during the appointment?
I always do. Yep. It's easy to forget things and I think it reassures you and I think it shows your physician, right, that you are actively involved and you're listening, right? That kind of active listening. And this is a relationship between you and your physician and you're both in it.
And Lauren Bavis, is a medical dictionary a good investment? I'm asking you as a former health reporter, is that something that would help like the average patient?
I think that's a great question. That's not something I think I've ever written about that I recommend patients would bring to an appointment. I think thinking as a journalist, a skill that can help a patient is coming up with a list of questions before you go to the appointment. I think walking out of an appointment, a lot of folks suddenly wonder, wait a minute, I didn't ask about this. I didn't think about that. And then like Lauren mentioned, that's where Googling or using AI as an assistant can kind of get you into trouble if it turns out the information that you get online isn't coming from a trustworthy source. So, I mean, the same way that a journalist prepares for an interview and does as much research as they can and develops a list of questions, I think coming to your appointment knowing these are the questions that I want answered and being polite but firm that until you have all of those questions answered, the doctor shouldn't leave the exam room. And I know doctors are really busy. They also have a lot on their plates, But if you don't have those questions answered, and if doctors don't take the time to answer those questions, that relationship and that trust doesn't build. And that's why we end up kind of in this situation that we're in now.
Now, this targeted rural health education program is obviously for doctors going into rural health. Do you think the information would apply to doctors who are going to work in a city or a suburban setting, or would it be different in some way?
I certainly think it would be applicable. I think it's particularly applicable in the rural setting because, and I say this to my students all the time, rural physicians aren't just rural physicians when they're in the office. They get stopped in the grocery store, at the post office, other kinds of places, and asked questions. They know all of their patients. Sometimes they treat many generations in a family. And being able to see these things in their community and being an advocate for their community's health isn't just something that they get to do. They really need to do it if they're the rural physician because they're more than just that physician in the community. And so learning these skills now and being able to do it in maybe a little bit more of a unique way where you're going to your local publication and seeing these larger scale problems and trying to do some health education versus doing this when you're standing in Wegmans maybe, I think is a unique opportunity that we're giving them to learn these skills now.
Well, it's very interesting, and I thank both of you for making time to tell us about it.
Absolutely. Thank you.
Yeah, thank you for having us.
My guests have been Lauren Meyer from Upstate's Department of Family Medicine and Lauren Bavis from Syracuse University's S.I. Newhouse School of Public Communications. The Informed Patient is a podcast covering health, science, and medicine brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brocal and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/inform. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.